Hello and good afternoon to everybody. I'm Dr. Himanshu Mathur on behalf of Jaipur Rehab. I welcome you all to join the online free biomechanics classes, and we are here today for the biomechanics of the knee joint part 2. Okay, so we had a wonderful first part of the biomechanics yesterday, and today we'll be looking forward to the second part of it. Okay, so it's already 12. Okay, it's just a few seconds left in getting 12. So okay, it's 12 now. Okay, now we can start officially. So let me share my screen first, and then we'll be starting it. Okay. Mhm. Just a second. Before I start today's class, we'll be going for a little recap, not of everything, but we'll be going for a short recap of one important thing, and this is this screw home mechanism. Now, anybody, I'll just be asking you a question. You just write the answer in the comment box. All right. Just a second. Let me start with my pointer. Okay, done. So, first of all, we'll be talking about, you will be answering me. I'll not be giving any answer. Okay, you can write your answers in the comment box. Okay, so the first question is, we are talking about open kinematic chain. Okay, in open kinematic chain, it means the tibia is free to move and femur is fixed. Now I'm talking about extension. Okay, now the question for me is that while the tibia, the knee joint is going into extension, at the terminal extension range of motion, what is the rotation of the tibia? How does the tibia rotate? You have 10 seconds to write it in the comment box. Go. The rotation of tibia in open kinematic chain extension is in which direction? Tell me, write down in the comment box. I can see the comment box. Come on, fast. I'm waiting for your answers. Screw home mechanism we are talking about, and you have to tell me that in terminal extension range of motion, in which direction the tibia rotates. Come on, tell me. Extension, nobody. That's very bad. We had a wonderful class yesterday. Come on, write the direction of rotation of tibia. No Googling, please. Don't Google. Just tell me the direction of rotation of tibia. Okay, I'll not wait anymore. So the direction of rotation of tibia is external rotation. Okay, it's the external rotation. Now, what about the flexion? That's very bad that nobody is replying onto it. What about flexion? What is the direction of rotation during flexion? It is internal rotation. Okay, this is the rotation of tibia. Now we'll be talking about the closed kinematic chain, CKC, in which, just a second, the femur is moving. Okay, the femur is moving and tibia is kept fixed. Okay, that is your spot. Okay, internal rotation you have written. No, it's not. It's external rotation. Yes, all those people who have written external rotation are correct. All those people who have written external rotation are correct. It's not internal rotation. Internal rotation is for flexion. Okay, during flexion it is internal rotation. Okay, if you have written external rotation for internal rotation for flexion, it is correct. Okay, now come on to the CKC, that is closed kinematic chain. Now the femur is moving here. Okay, all right. Okay, Meenal Jain has already written that. Correct. extension, during extension, the femur rotates internally. उल्टा हो जाएगा पिछली बार का बिल्कुल, ठीक है ना, internal rotation. All right. And when I talk about flexion, in flexion, the femur rotates externally. So I write external rotation. Okay. In the terminal, this is the squat motion, squatting. Okay. So this is what we have to talk about. Okay. That is a very easier thing to remember. Okay. You don't require any, what you can say, rocket science to know this thing. Okay. Now coming on to today's thing. Today we'll be talking about the kinetics of the knee joint. Kinetics will tell you about the forces that are acting. The muscles basically we'll be talking about, okay? Because we all know while we'll be talking about the muscles, we'll know about that what are the forces on which the muscles are working and how much is the force that they are applying, okay? So first of all, we'll be starting this by knee extensor mechanism. Okay. So when I talk about the knee extensor mechanism, the isometric contraction. Okay. What is the major muscle that aids for the extension of knee? That is quadriceps. Quadriceps has four muscles. Four muscles are rectus femoris, vastus. We have three muscles from vastus. Okay. Vastus medialis, vastus lateralis, and vastus intermedius. Okay. Now, vastus group of muscles is a uniarticular muscle or a monoarticular muscle that it crosses only one joint, that is the knee joint, tibiofemoral joint. But rectus femoris is a biarticular muscle that it crosses the knee joint also and it crosses the hip joint also. So it acts as a secondary flexor for the knee joint, for the hip joint, and a primary extensor for the knee joint. So the force that it applies, the rectus femoris muscle, is distributed between two joints. This is the reason why the major amount of force applicable for the extension of knee, it is applied by the vastus group. So it is being said by the cadaveric studies that almost 80% of the total force of the extension is generated by the vastus group, and the remaining 20% is generated by the rectus group. Okay, now let us see what I've written. The isometric contraction of the quadriceps stabilizes the knee, and eccentric activation controls the rate of descent. Always remember, okay, just imagine one thing, squatting position. I am getting down in squatting and coming up in squatting. So whenever I am coming up from squatting, it means it is the extension of the knee joint. If it is the extension of the knee joint, the primary extensor is quadriceps. Okay, so quadriceps will work concentrically. All right. If the knee is coming back in extension, the quadriceps will work concentrically. At the same time, gluteus maximus will also work concentrically, because there is some amount of extension which is occurring at the hip joint also. So both the gluteus maximus and quadriceps play a very good role while a patient gets back from the squatting position. Okay, but now we are talking only about the knee joint. Okay, so whenever I talk about the knee joint, in the knee joint, whenever we are getting back from squatting position or getting up from squatting position, the quadriceps work eccentrically. And when I get down in the squatting position, when the knee is in flexion, see, if the knee is in flexion, if I'm getting down, I do not require extensive work of the flexor muscle, because there is a gravity which is acting, which is taking me down. Now there has to be some force which should control the action of gravity which is taking me down. अगर ऐसा नहीं होगा, ग्रेविटी के एक्शन पे चेक नहीं होगा, तो आई विल फॉल डाउन, मैं गिर जाऊंगा नीचे. लेकिन मैं गिरता तो नहीं हूं स्क्वाटिंग में नीचे. तो it is because of the eccentric action of the quadriceps muscle. Okay, so whenever I am talking about close kinematic chain, so whenever I am getting down in squatting, it is the eccentric action of the quadriceps. And whenever I am coming up from the squat position, It is the concentric work of the quadriceps which is taking me up. Okay, so it means that in closed kinematic chain flexion also, quadriceps is working eccentrically so as to control the downward displacement of my body, or to control the descent of my body. Okay, now let us see what is written. As eccentric activation works like a spring, it dampens the impact of loading of the joint. Obviously, because I don't want my joint to be overloaded, I don't want my joint to be to have more compressive loading. That is why quadriceps work eccentrically, and it absorbs all the other extra force which is working over here. All right. Now, the large vastus group provides about 80% of the total extension torque, and 20% is by rectus femoris. I told you already. The vastus group extends the knee only when the rectus flexes hip as well. Okay, rectus and vastus, they also work conjointly whenever you perform SLR. SLR is when you will lie down, and straight leg raise whenever you are doing. So rectus femoris is working with the vastus to provide extension at the knee. At the same time, it is also providing flexion at the hip joint. Or whenever you are kicking a ball while into a say football matches and things like that, the knee goes into flexion and the hip goes into extension, and suddenly with a jerk, the player kicks the ball. So it is by the action of both the vastus along with the rectus femoris muscle also. Okay. Now the quadricep muscle and tendon, patella and patellar ligament are often described as the knee extensor mechanism. Okay. So these 3-4 things constitutes the knee extensor mechanism. Now, although vastus lateralis is the largest of all, always consider that vastus lateralis has the largest cross-sectional area also, and it is the largest force producing muscle. This is the major reason why whenever the quadriceps contracts concentrically, it pulls the patella laterally. That is what you call it as a lateral patellar tracking. Okay, so whenever there is a weakness of any medial component that we'll be discussing in our later slides, so there is normal lateral tracking of the patella. Although some lateral tracking of patella is physiological, it is normal. Okay, नॉर्मली भी जब मैं नी को एक्सटेंड करता हूं तो मेरा पटेला जो है वो लेटरल साइड में जाता है. सो इट इज प्रिटी मच नॉर्मल. ओके, ये कोई बीमारी नहीं है, क्योंकि बिकॉज माई vastus lateralis is a very large muscle, is a very large torque generating muscle. It has a very large cross sectional area. So the major force production is being done by vastus lateralis muscle. Okay, vastus medialis is also there, as you can visualize it very easily in this particular diagram that you can see here. Okay, this is what you can see here. Okay, so if you can see here, you have very obliquely placed fibers of the vastus group, and you have some vertical fibers of the vastus group as well. Okay, so usually the alignment of fibers along with whenever I draw an angle, which is just a second, I'll just try to draw it. So whenever you do this, okay, and if you take the angle of these fibers and if you take the angle of these fibers, right, of these fibers, okay, it's not working, right, these fibers. Okay, so if you draw a straight line and you take angle of these fibers and the fibers located down there, so those fibers are more angulated with the vertical plane at an angle of nearly 50 to 55 degrees. So they are more obliquely placed, and that is why those fibers are known as vastus medialis obliquus, and the more straighter fibers are known as vastus medialis longus. Okay, so we have two types of fibers of vastus medialis. These are vastus medialis longus and vastus medialis obliquus. Obliquus fibers play a very good role in excessive mal tracking of the patella, that is excessive lateral tracking of the patella. Okay, if we do not have a pull from VMO fibers, the patella would rather go more into lateral tracking. Okay, Now VMO fibers accounts only for 30% of the total cross-sectional area of the total vastus medialis muscle group. Okay, so rest 70% is your vastus medialis longus only. Okay, only 30% fibers are vastus medialis obliquus. Okay, now it creates an oblique pull on patella as it tracks or slides through the intercondylar groove of the femur. Okay, when it tracks, when it tries to go more laterally, the VMO fibers pull it back towards the medial side, so it stays to be in the center. All right, it is against the extensive pull that is being employed by the vastus lateralis group. So this is a wonderful graph I would like to show you, that this is a graph for knee flexors and extensors. Now if you can see that this is the pink one is the extensor group of muscles of the knee. The rest one is your flexor group of the muscles. Okay, so if you see, the maximum torque production is that the hamstring is providing the maximum torque, being the major flexor of the knee. Okay, if I see how much is that, this is around 100 Newton meter. Okay, and if I see it about the vastus group alone is giving you 250 Newton meter. Okay, so if conjointly I talk about the vastus group and the rectus group, rectus is giving again 50 Newton meter. So the total torque generation by the extensor group is nearly about 300 Newton meter. Okay, now the rest, if I take all the this flexor group, this is accounts for nearly almost less than 150 degrees, 150 Newton meter. So in any or the other way, the quadriceps to hamstring ratio for the torque production, the torque produced by the quadriceps is always greater than that of the hamstring. Okay, so whenever you take a quadriceps to hamstring ratio, it is always more than 1. But this is the reason why that whenever you take the hamstring to quadriceps ratio, which is of more benefit, it is always less than 1. All right, so do consider in your mind that quadriceps is a large muscle. It is a largely force producing muscle, and amongst the quadriceps, vastus group is the most torque generating muscle amongst all the muscles which are lying across the knee joint, around the knee joint. Vastus group is the largest torque producing muscle. Okay, talking about the patella, the augmentation of knee extension and its leverage. So we had a very brief account yesterday also. So the functionally, patella displaces the tendon of quadriceps anteriorly. Now just look at the diagram that I'll be drawing. Suppose this is we'll be seeing the lateral view. Okay, suppose this is the leg. Okay, and suppose this is the knee joint here, and we have patella here. If we didn't had patella, and if I have to draw, or if I have to place the quadricep muscle, the muscle would have come like this, and it would have been close to the joint. Okay, if we didn't had patella. Okay, if we didn't had patella. Now here is the axis of rotation for the knee joint, so the momentum would have been pretty much less. But we have patella, and the quadriceps is going above the patella. Okay, so it is causing some distance. So now if the axis of rotation is this, we have certain amount of momentum. So the patella is eventually deflecting your quadriceps muscles such that it generates some amount of leverage or some amount of momentum, so that an extensive torque for the extension could be generated by the quadriceps. Okay, so that is why it is written, functionally patella displaces the tendon of quadriceps anteriorly, thereby increasing an internal momentum. Internal momentum is by the attachment of the muscle. Okay, and the muscle attaches onto the base of patella. We know that. Okay, this is how patella augments the torque potential of the quadriceps. Okay, now we all know that, since we have studied in the last lecture of the hip joint also, that if the person or if a joint is in static equilibrium, the external torque is always equal to the internal torque. Okay, now we'll see it somewhere here. Okay, if you can see it here, so in this position, the knee is in semi extension and is in a static position. Now if the leg or the knee is in static position of, say, it's around 30 degrees of, it's not 30 degrees, you can say around 70 degrees of knee flexion, it is there. Okay, so here the internal torque must be equal to the external torque. Okay, we know it from the last lecture, right? We know, everybody. I'm just repeating the same thing. Now, internal torque is the force by quadriceps into momentum. That is the internal momentum. Now, what is the internal momentum? Is from the site of attachment of the quadriceps muscle here to that of the perpendicular distance to that of the axis of rotation, the evolute. We talked about it yesterday. Okay, so this is the internal momentum, which is eventually equal to the external force. Okay, I would rather write it as force E into the external momentum. Now, the external momentum is again the distance of the fulcrum to the external weight, which is mentioned here. Okay, this one. This is the external weight. So this is the perpendicular distance between this is the external momentum. Now, by the cadaveric studies, if we know internal momentum, by normal measurement, if we know external momentum and the force which we are applying or which we have placed on proximal to the ankle, if we know that particular force, we can easily calculate the force of the quadriceps. Okay, it will become the external force multiplied by the external momentum upon the internal momentum. Okay, so this is the simple formula by which we can calculate the force applied by the quadriceps at this particular range of motion, or at this particular time when the knee is in static equilibrium. All right, now external torque demands against the quadriceps. Okay, now this is one important thing what you should learn, which will give you an insight of the clinical practice or inculcation of the study what we are doing today. That will give you an insight about it. Okay, now it tells you that the external momentum during open kinematic chain increases in the last 90 degrees of extension. So if the external momentum increases in the last 90 degrees of extension, it means that the external torque would also increase. Now, to overcome that torque, the quadriceps will have to work more. Remember the last formula? This last formula, this has to be equal. Okay, now if I am going against gravity or against any load, I have to overcome this particular thing. Okay, I have to overcome the external torque. If my external force, if my external torque or external load is more, I have to generate more internal torque so as to cause the movement. अगर मैं सेम करूंगा तो इक्विलिब्रियम में आ जाएगा, रुक जाएगा. लेकिन मुझे अगर अगेंस्ट मूवमेंट करना है तो एक्सटर्नल टॉर्क से ज्यादा टॉर्क चाहिए मुझे इंटरनल वाला. ठीक है ना, तब कहीं जाकर के मूवमेंट कॉज होगा वहां पे. ओके, अब अगर एक्सटर्नल टॉर्क ज्यादा लगा दिया कुछ अमाउंट लगा दिया, तो ये इन दोनों एंटिटीज में से मुझे इस वैल्यू को बढ़ाना है, इंटरनल टॉर्क को मुझे बढ़ाना है. लेकिन आपको पता है इंटरनल मोमेंटम इज ऑलवेज फिक्स्ड, क्योंकि मैं अटैचमेंट थोड़ी चेंज कर सकता हूँ किसी जगह का. ठीक है ना, अटैचमेंट अगर पटेला पे क्वाड्रिसेप्स का हो रहा है तो पटेला पे ही होगा क्वाड्रिसेप्स का, और पटेला का जो मूवमेंट पैटर्न फिजियोलॉजिकली डिफाइंड है वैसा ही होगा. तो मैं किस चीज को ऑल्टर कर सकता हूं? मैं ऑल्टर कर सकता हूं इस चीज को, मैं फोर्स ऑफ क्वाड्रिसेप्स को ऑल्टर कर सकता हूं. इसका मतलब अगर ज्यादा एक्सटर्नल मोमेंटम होगा तो मुझे उतना ही ज्यादा क्वाड्रिसेप्स का फोर्स लगाना पड़ेगा, सो सच दैट कि मुझे वो मूवमेंट कराना पड़े. ठीक है ना, वरना मुझे कम से कम एक्सटर्नल टॉर्क, जितना टॉर्क तो जनरेट करना ही पड़ेगा उस फोर्स को बढ़ा करके कि कम से कम वो इक्विलिब्रियम में आ जाए. ठीक है, तो नाउ दिस इज द रीजन, दिस विल गिव यू अ वेरी गुड क्लिनिकल इंसाइट दैट द एक्सटर्नल टॉर्क्स आर रिलेटिवली लार्ज in close kinematic chain when we talk about the extension from 90 to 45 degrees. ओके, जब मैं 90 से मतलब मिड स्क्वाट से 45 के बीच में आता हूं, मतलब मिड से 45 के बीच में आ रहा हूं, तो भी जो एक्सटर्नल टॉर्क डिमांड्स होती हैं वो हमेशा ज्यादा होती है. तो अगेन अगर एक्सटर्नल टॉर्क डिमांड्स उस रेंज के बीच में ज्यादा होंगी तो मेरी क्वाड्रिसेप्स को ज्यादा काम करना पड़ेगा. तो नाउ आई हैव टू चूज अ रेंज ऑफ मोशन जहां पे एक्सटर्नल टॉर्क कम हो. तो उससे क्या होगा, मेरी क्वाड्रिसेप्स को कम काम करना पड़ेगा। और अगर मेरी एक्सटर्नल इंटरनल टॉर्क दोनों ही ज्यादा हो रहे हैं तो अल्टीमेटली तो जो जॉइंट रिएक्शन फोर्स है वो भी बढ़ेगा, ठीक है ना, क्योंकि अल्टीमेटली जो फोर्स ऑफ कॉन्ट्रैक्शन ऑफ द मसल है वो ही तो जॉइंट रिएक्शन फोर्स डिफाइन करता है वेट के साथ, ठीक है। तो अगर मेरी फोर्स ऑफ कॉन्ट्रैक्शन ऑफ क्वाड्रिसेप्स ज्यादा होगी तो वो उतना ही ज्यादा पुल करेगी उस चीज को। तो अल्टीमेटली एक जॉइंट को नॉर्मलाइज होने के लिए मुझे एक छोटा सा काम क्या करना है, मुझे एक काम ये करना है, मुझे वो रेंज ऑफ मोशन चूज करना है जहां पे एक्सटर्नल टॉर्क डिमांड्स कम हो। और वो कौन सा होता है, वो होता है 90 डिग्री से लेकर के 45 डिग्री तक का ओपन काइनेमेटिक चेन में। तो अब जब मैं बात कर रहा हूं ओपन काइनेमेटिक चेन में, तो ये जो रेंज आप देख रहे हैं, दिस रेंज हैज वेरी लेस एक्सटर्नल टॉर्क डिमांड्स। आप देख रहे हो कि यहाँ पे जो था, यहाँ पे बिल्कुल एक्सिस ऑफ रोटेशन और एक्सटर्नल टॉर्क का जो सीओजी इट इज लाइंग इन द सेम लाइन, ओके। यहाँ पे जब मैं बात कर रहा हूं तो इस रीजन में ये है मेरा मोमेंटम, एक्सटर्नल मोमेंटम। तो यहाँ पे एक्सटर्नल मोमेंटम कम है। अगर एक्सटर्नल मोमेंटम कम है तो एक्सटर्नल टॉर्क भी कम होगा। एक्सटर्नल टॉर्क कम होगा तो उसको मेरी क्वाड्रिसेप्स इजीली ओवरकम कर पाएगी, ओके। अब वही यहाँ पे ऑन कंपैरिजन की अगर मैं यहाँ बात करूं तो यहाँ पे ये और ये डिस्टेंस ज्यादा हो जाता है, तो मेरा एक्सटर्नल मोमेंटम मेरा यहाँ पे बढ़ जाता है, ओके। अगर एक्सटर्नल मोमेंटम मेरा इस केस में बढ़ जाता है तो मेरा एक्सटर्नल टॉर्क भी बढ़ जाता है। तो अगर मेरा एक्सटर्नल टॉर्क भी बढ़ जाता है तो मेरी क्वाड्रिसेप्स को हमेशा ज्यादा काम करना पड़ेगा ये पर्टिकुलर मूवमेंट कराने के लिए, या फिर एक्सटेंशन में ही बैलेंस करने के लिए, रोक देने के लिए। एक्सटेंशन में भी अगर मैं स्टैटिक इक्विलिब्रियम करा रहा हूं तो मुझे क्वाड्रिसेप्स का बहुत ज्यादा लोड चाहिएगा अगर फुल एक्सटेंशन पे मैं कराता हूं तो क्यों ना हम ऐसा करें कि कभी कि हम इस रेंज से लेके इस रेंज के बीच में अगर एक्सरसाइज कराएं, मतलब दिस इज 90 डिग्री एंड दिस इज 45 डिग्री ओपन काइनेमेटिक चेन में। तो अगर ओकेसी में अगर मैं 90 डिग्री से लेके 45 डिग्री के बीच में अगर मैं एक्सरसाइज कराता हूं और बाय चांस में थोड़ा सा एक्सटर्नल रेजिस्टेंस भी लगाता हूं तो कम से कम मेरी क्वाड्रिसेप्स को उतना ज्यादा वर्क नहीं करना पड़ेगा जितना ज्यादा क्वाड्रिसेप्स को यहाँ वर्क करना पड़ रहा है। और यही रीजन है कि अगर मैं कराता हूं तो मेरी जॉइंट का डीजनरेशन नहीं होगा इस पर्टिकुलर रेंज के बीच में। डीजनरेशन नहीं होगा तो आई कैन प्रिवेंट ऑस्टियोकॉन्ड्रल चेंजेस लाइक ऑस्टियोआर्थराइटिस ऑफ नी जॉइंट। और यही रीजन है कि हमको कभी भी डायनेमिक एक्सरसाइज जो होती है नी जॉइंट की वो कंप्लीट एक्सटेंशन में नहीं करवानी चाहिए। हम अगर डायनेमिक एक्सरसाइज कंप्लीट एक्सटेंशन तक ले जाकर के करवाएंगे नी जॉइंट की तो हमेशा वी आर प्रमोटिंग द डीजनरेशन। इसका मतलब हम करवा तो इसलिए रहे हैं ताकि ऑस्टियोआर्थराइटिस का लेवल कहीं ना कहीं कंट्रोल हो जाए, लेकिन इवेंचुअली हम ऑस्टियोआर्थराइटिस को बढ़ा रहे हैं, ओके। सो फ्रॉम नाउ इट इज एन क्लिनिकल इंसाइट टू एवरीबॉडी, अगर आप नी की या क्वाड्रिसेप्स की डायनामिक एक्सरसाइज करा रहे हो तो ऑलवेज सेलेक्ट द रेंज ऑफ मोशन फ्रॉम 90 डिग्री टू 45 डिग्री। 90 डिग्री मतलब पांव हैंग कर रहे हैं नीचे, वहां से लेकर के 45 डिग्री तक जाएंगे आप, ओके। उससे आगे जाते ही एक्सटर्नल टॉर्क डिमांड ज्यादा हो जाती है तो क्वाड्रिसेप्स का कॉन्ट्रैक्शन भी ज्यादा हो जाता है। क्वाड्रिसेप्स का कॉन्ट्रैक्शन ज्यादा होगा तो जॉइंट रिएक्शन फोर्स और कंप्रेसिव फोर्स एट द नी जॉइंट अपने आप से बढ़ जाएगा, ओके। इजी इन द ओपन काइनेमेटिक चेन। नाउ आई विल टेल यू द सेम थिंग इन द क्लोज्ड काइनेमेटिक चेन। नाउ अगेन दिस इज समवेयर नियर टू द 90 डिग्रीज, ओके। और जैसे ही 90 डिग्री से यहाँ के बीच में आ रहा है तो ये वाला क्या कहना चाहिए, दिस वन एंड दिस वन, ओके। सो दिस वाज द मोमेंटम अर्लियर एंड दिस वाज द मोमेंटम अर्लियर, यहाँ पे, ठीक है ना। तो यहाँ से कम होता होता तो मैक्सिमम मोमेंटम व्हाट वी आर गेटिंग इज फ्रॉम 90 डिग्री, दिस इज 90 डिग्री, दिस इज 45 डिग्री एंड दिस इज 0 डिग्री, this one is 0 degree, okay, complete standing upright position, okay. So we have greater external momentum between 90 degree and 45 degree. You can see that यहाँ पे मोमेंटम ज्यादा है, यहाँ पे भी मोमेंटम ज्यादा है, लेकिन यहाँ से यहाँ के बीच में मोमेंटम काफी कम हो रहा है। एक्सटर्नल मोमेंटम जो है वो यहाँ से यहाँ के बीच में रिड्यूस हो रहा है। तो अगर सेम चीज में यहाँ से यहाँ, मतलब अगर मैं किसी ऑस्टियोआर्थराइटिस के पेशेंट को हाफ स्क्वाट करा रहा हूँ, हाफ स्क्वाट से जब पेशेंट वापस ऊपर आ रहा है तो हमेशा एक्सटर्नल मोमेंटम की डिमांड्स ज्यादा होती हैं। अगर एक्सटर्नल मोमेंट आर्म की डिमांड ज्यादा है तो क्वाड्रिसेप्स का कॉन्ट्रैक्शन हमेशा ज्यादा होगा। क्वाड्रिसेप्स का कॉन्ट्रैक्शन अगर ज्यादा होगा तो हमेशा जॉइंट रिएक्शन फोर्स ज्यादा होगा और कंप्रेसिव फोर्स भी ज्यादा होगा। अगर कंप्रेसिव फोर्स ज्यादा होगा तो हमेशा डीजनरेशन एनहांस हो जाएगा, ठीक है ना। तो हम हमेशा पेशेंट की हालत में सुधार नहीं कर रहे हैं इस चीज से, हम पेशेंट के जॉइंट को खराब कर रहे हैं इस पर्टिकुलर चीज से। Okay, so rather it is always better and prescribed to go for mini squat। mini squat मतलब वो एक्सरसाइज जो कि 45 डिग्री से 0 डिग्री के बीच में लाई कर रही है, ठीक है ना। तो हमको हमेशा एक्सरसाइजेस जो स्क्वाट करानी चाहिए, स्क्वाटिंग एक्सरसाइज करानी चाहिए, स्पेशली डीजनरेटिव केसेस के अंदर, तो वो हमेशा हम कराएंगे 45 डिग्री से 0 डिग्री तक में, ठीक है ना। सो विल ऑलवेज गो फॉर mini squat, we'll never go for full squat or half squat for the patients with degenerative cases of knee joint. Okay, I think that must be clear to everybody of you. Okay, now the internal torque demands. The maximal knee extension torque generation occurs between 45 to 60 degrees. ओके मतलब नी एक्सटेंशन का जो टॉर्क होता है वो मैक्सिमम कहां जनरेट होता है क्वाड्रिसेप्स का, 45 से 60 डिग्रीज ऑफ नी फ्लेक्शन के ऊपर। ओके, नाउ मैक्सिमम टॉर्क इज एक्चुअली जस्ट अ सेकेंड, मैक्सिमम टॉर्क इज एक्चुअली जनरेटेड बिटवीन 30 टू 80, मतलब ये एक रेंज दे दी। अब 30 से 80 के बीच में भी जो 45 से 60 की रेंज है वहां पे सबसे ज्यादा इंटरनल टॉर्क जनरेट होता है। ओके, तो एक विंडो जो हमारे पास है वो है 30 डिग्री ऑफ फ्लेक्शन से लेके 80 डिग्री ऑफ फ्लेक्शन के बीच में, तो वहां पे पूरे में एक बहुत ही अच्छा खासा इंटरनल टॉर्क जनरेशन का इंटरनल टॉर्क का जनरेशन होता है। ओके, द विंडो इज ऑफ 50 डिग्रीज ऑफ हाई टॉर्क पोटेंशियल is incorporated in closed chain activities including ascending the high step, holding a partial squat position. Rapid decline in the internal extension torque occurs as the patient approaches or the knee approaches extension. ये बात हम लोग कल ही जान गए थे कि जैसे ही जो नी है कंप्लीट एक्सटेंशन में आती है, जो पटेला है वो ऊपर आ जाता है टुवर्ड्स द मीडियल लैटरल एक्सिस ऑफ रोटेशन। तो जब टुवर्ड्स द एक्सिस ऑफ रोटेशन आ जाता है वहां से पटेला, तो इट इज कमिंग टुवर्ड्स द एक्सिस, टुवर्ड्स द फुलक्रम। If it is coming towards the fulcrum or close to the fulcrum, the moment arm would reduce. And if the internal moment arm is reduced, in that case, the torque generated by the quadriceps will also lower down. This is the reason why in complete extension, the extension torque is very low and the demand is also very low. Now talking about the patellofemoral joint kinetics, it's again a very very beautiful thing. If you people can understand it, the patellofemoral joint kinematics, I'll be telling it to you with the help of a diagram also. I'll be explaining it to you. Okay, so whenever we talk about the patellofemoral joint kinetics, we always try to see that, जब भी पटेलोफेमरल जॉइंट का पेशेंट हमारे पास आता है तो पीएफपीएस में द मेजर प्रॉब्लम द पेशेंट कंप्लेन्स टू यू इज द डीजनरेशन और द इंक्रीज्ड कंप्रेसिव फोर्स। तो पटेलोफेमरल जॉइंट में के ट्रीटमेंट में जो हम बेस्ट कर सकते हैं हर बार, वो सिर्फ एक ही चीज है, दैट इज योर रिडक्शन इन द कंप्रेसिव लोडिंग ऑफ द पटेलोफेमरल जॉइंट। ओके, रिडक्शन इन दी, हम सारी स्ट्रेटेजीज वही एम्प्लॉय करते हैं कि जहां पे पटेलोफेमरल जॉइंट के बीच का जो कंप्रेसिव वो रिड्यूस हो सके। अब पहले हम ये देखेंगे कि वो कौन सी पोजीशंस है जहां पे पटेलोफेमरल जॉइंट जो है वो हाईली लोडेड होता है। ओके, नाउ द पटेलोफेमरल जॉइंट कंप्रेसिव फोर्स मे रीच 3.3 टाइम्स ऑफ द होल बॉडी वेट व्हाइल क्लाइंबिंग स्टेयर्स। जब मैं सीढ़ियां चढ़ रहा हूं तो जो पटेलोफेमरल जॉइंट के बीच में कंप्रेसिव फोर्स है या जॉइंट रिएक्शन फोर्स है वो इतना बढ़ सकता है, कितना, मेरी बॉडी के 3 गुना जितना। ओके, एंड इट मे राइज टू 7.8 टाइम्स द बॉडी वेट ड्यूरिंग डीप नी स्क्वाट। ओके, इसीलिए हम बार बार हर उस पेशेंट के लिए जिसको कि डीजनरेशन है नी में मना करते हैं कि डीप स्क्वाटिंग नहीं करनी है, क्योंकि अगर आप डीप स्क्वाटिंग करेंगे तो जो कंप्रेसिव लोड है जो कि आपकी पीएफ जॉइंट में आ रहा है, पटेलोफेमरल जॉइंट में आ रहा है, वो बढ़ते बढ़ते तकरीबन 8 गुना हो जाता है आपके बॉडी वेट का। मतलब मान लो अगर आपका बॉडी वेट 60 kgs है तो जो पटेलोफीमरल जॉइंट के बीच में कंप्रेसिव लोड आ रहा है, दैट बिकम्स योर 640 kgs, नियरली इक्वल्स टू 600 नहीं 480 kgs, आई एम सॉरी, ठीक है ना। तो तकरीबन 500 किलो का वजन आपके लाई कर रहा है दो जॉइंट सरफेसेस के बीच में, ऑलराइट, व्हेन वी आर डूइंग डीप स्क्वाट. Okay, now the important factors responsible for this includes yes, I can teach in English because there are a lot of other students also who are okay. I'll be teaching in both Hindi and English, all right. So what I was telling is the patients of patellofemoral pain dysfunction that comes to us majorly has one common problem, is the enhancement or the increased compressive loading or the joint reaction force between the articular surfaces. So we try to employ all those techniques, all those strategies which eventually reduces the compressive loading between the articular surfaces. So here we are trying to know that which are those positions that eventually increases the joint reaction force and the compressive load between the articular surfaces of the patella and femur. Okay, now the important factors that are responsible for this includes a large magnitude of the quadriceps force. That is what we talked about in the last few slides, which told us that when it is the position when the external moment arm or the external torque demands are high. So whenever there will be high external torque demands, in those cases the force of quadriceps will always be high. Okay, whenever the force of quadriceps is high, in that case there is always increased amount of joint reaction force, all right, which eventually gives you the values of say 3.3 times of the body weight or 7.8 times of the body weight. All right, now the angle of the knee joint at the time of muscle activation, that will be talking in this slide and in the next slide also. Okay, there are two factors which are most responsible is they include the force of contraction of the quadriceps and the angulation of the knee. Angulation of the knee is the most important thing, which eventually describes the vectors. वो आपके जो फोर्स है उसके वेक्टर्स को डिफाइन करता है. ओके, और वो जो वेक्टर्स का जो रिजल्टेंट डायरेक्शन होता है वहां पे हमेशा उसी डायरेक्शन में कंप्रेसिव फोर्स मैक्सिमम होता है. हम अभी देखेंगे कैसे. The forces are transmitted proximally and distally through the quadriceps, the resultant of which is directed towards intercondylar groove of the femur. The increase in the angle of flexion significantly increases the resultant compressive force of the PF joint by raising demands of the extensor mechanism. I'll tell you how. Supposingly, this is your joint in mini squat position or nearly starting position. This is the patella. Now there is one force which is acting superiorly, that is the force by the quadriceps. Another force is by the tensile strength of the ligamentum patellae, that is the force by ligamentum patellae, or I'll call it as LP. All right. So whenever the patella is pulled superiorly by quadriceps and inferiorly by ligamentum patellae, so if a body is like this, one force is going like this, the other force is going like this. So this can be your Y component, this can be your X component. This resultant of this would be horizontal in between both of them. Okay, now if the magnitude of these forces is low, the compressive loading in this direction or the resultant force in this direction will also have low magnitude. Now if the angulation, this angulation eventually increases with force like this, with increased magnitude force. So as we all know that as soon as we go into deep squat, more force is applied by the quadriceps. We just had in the last few slides we learned that. हमने अभी अभी सीखा कि जब हम डीप स्क्वाट के अंदर जाते हैं तो हमेशा क्वाड्रिसेप्स का जो लोड है, क्वाड्रिसेप्स का जो फोर्स है वो इंक्रीज हो जाता है. तो अगर क्वाड्रिसेप्स का फोर्स यहाँ पे इंक्रीज हो जाएगा, सो दिस इज द फोर्स क्वाड्रिसेप्स एंड दिस इज द फोर्स लिगामेंटम पटेले. अगर दोनों ही तरफ के फोर्स इंक्रीज होंगे तो इवेंचुअली जो रिजल्टेंट फोर्स है उसका भी मैग्नीट्यूड इंक्रीज हो जाएगा, एंड दैट विल बी टुवर्ड्स दिस. सी this is the articulating surface of the patella and this is the articulating surface of the femur, and it is directly going inside, okay, with a larger magnitude. If it is going inside with a larger magnitude, this compressive force or this joint reaction force eventually will degenerate the articular cartilage, and the patient has came to you because he already has problems with his articular cartilage degeneration. if the patient has come to you with patellofemoral pain syndrome or patellofemoral joint arthritis. All right. So if you want to prevent patellofemoral joint arthritis or patellofemoral joint pain or chondromalacia patella, always try to prevent deep squat. I'll just write this: prevent deep squat. Even if the patient is having OA or PFPS or chondromalacia patella or PFJ arthritis, just try to avoid deep squat. Okay, not prevent. I'll write avoid deep squat. Okay, try to avoid deep squat. All right, deep squat is no use whenever you are rehabilitating any degenerative disorders. Okay, it can be used in athletic population whenever you are talking about the whenever you're talking about the what you can say, athletic individuals, and in strength training of the athletic individuals, you can use the body weight for that. All right. Now we have come to the patellar tracking. We had a small discussion about patellar tracking. The lateral tracking of patella is physiological. Okay, it is by the action of vastus lateralis, and we know that vastus lateralis is a muscle with larger cross-sectional area, and because it has larger cross-sectional area and large force production and large torque generation, it pulls the patella laterally. Okay, so when it pulls the patella laterally, there is a physiological deviation of patella while you are going into extension of the knee joint. Now, if we do not have any counteracting forces at the patella, the vastus lateralis would rather pull the patella into extremes of the lateral sides of the knee joint. So we have certain things here that which counteracts the force of the vastus lateralis. So the first thing that acts here is the pull by the VMO. So you can see here the vastus medialis here. So this vastus medialis obliquus fibers, because they are oriented at an angle of 50 to 55 degrees, it creates a pull laterally, which eventually counteracts the lateral pull. Okay. Another thing that you have are the patellar retinacular fibers. Although the patellar retinacular fibers are not contractile tissue, so the tensile strength present inside the patellar retinacular fibers eventually prevents the extensive lateral tracking of the patella. Okay, or I would say that they actually prevents the mal tracking of patella into the lateral sides. Okay, now what could be the other factors that would lateral tracking of patella? That would include a pull of the iliotibial band also. Although iliotibial band does not have a direct contact with the patella, but through the extensor mechanism fibers or the other soft tissues, there can be a lateral pull generated by the iliotibial band, and of course the lateral patellar retinacular fibers, which are located somewhere over here. Okay, so they produce a lateral pull, which is very efficiently counteracted by the soft tissue pull of the vastus medialis obliquus fibers, and of course the tensile strength of your patellar retinacular fibers. Another thing which contributes for counteracting the abnormal lateral patellar tracking is the lateral facet, which is normally raised when the within the intercondylar groove during the extension or during the terminal ranges of extension. Okay, so this is another thing, or you can say it could be because of the extensive close pull generated by the VMO fibers. So the lateral end of the lateral margin of the patella is lifted off, which eventually prevents it from going on the extremes of the lateral side. Now, control of the tibial on femoral osteokinematics. Now we are talking about the open kinematic chain here. Okay, so the major work which is being done by in the open kinematic chain, especially in the flexion region, is by the flexor rotator group of muscle. Now, whenever the knee is going into flexion, this flexor rotator compartment works in concentric pattern, and whenever the knee goes into extension, then this flexor rotator group of muscle works in eccentric pattern, to control that particular motion. Okay, in open kinematic chain, I'll just write it here. Open kinematic chain we are talking about. Okay, so this flexor rotator group of muscles include hamstrings, as you can see it here. Where is it? Yeah, you can see hamstring, sartorius, gracilis, popliteus, and gastrocnemius. Okay, gastrocnemius has its origins on the posterior aspect of the distal end of the femur, femoral condyle. Okay, so it is also a secondary knee flexor. All right. Now, important action of flexor rotator muscles is to accelerate or decelerate tibia during walking or running. Okay, so whenever during walking, whenever I'm going into after the terminal swing, when my knee is going for extension, then these muscles decelerate the action or the speed of my knee joint or the tibia by its eccentric activation. And after the toe off, when my knee is going into flexion, these are the muscles which works concentrically to pull or to take my tibia into flexion. All right, they also helps in while running. Okay, now through the eccentric activation or through the eccentric action, the muscle helps to dampen the impact in full extension. That is what I was saying. These muscles gets activated whenever my knee is going into extension. Okay, the same muscles rapidly contract to accelerate knee flexion in order to shorten the functional length of the lower limb during swing phase. That is what I was talking about during the swing phase. Okay, so after the swing phase, whenever my knee is going into extension, whenever the leg is being brought towards the ground, these muscles work eccentrically to dampen the effect and lessen the speed. Okay, now I'm talking about the CKC, closed kinematic chain, the control of femoral on tibial osteokinematics. This time the tibia is fixed, okay, and the femur is moving. Okay, so whenever the femur is moving, the stability and control at the knee require an interaction of forces, being the combined action of muscles and ligaments. We'll be talking how the muscles and work, different group of muscle works in combination. Okay, now with right foot planted, the right foot planted, you are on unilateral stance. The short head of biceps of femur accelerates the rotation of femur internally. So, okay, so whenever you are going into extension or whenever you're coming back from the squat position, in the terminal extension range, there are bicep femoris which try to accelerate the rotation of femur. Okay, now, and the eccentric activation of pes inserenius muscle helps to decelerate the internal rotation of femur and pelvis over the tibia as well. Okay, now we have to talk about the maximal torque production of the knee flexor rotator muscles also. Now, the greatest knee flexion torque is generally near full extension. We all know about it. Now, there can be two reasons behind it. One is the momentum for the flexors would be high whenever I'll be going into complete extension. Number one. The number two factor could be whenever I'm going into complete extension, the flexor group of muscles gets stretched. They are at their maximum length. So whenever they are at their maximum length, in that case, a stretch reflex is being initiated, which promotes the muscles to contract. And whenever there will be more contraction because of the stretch reflex of the flexor muscles, there will be more torque generation of the flexion at the knee joint. Okay. Now, hamstring amongst all the muscles have their greatest internal momentum at about 45 degrees of the knee flexion. In last few slides, we just saw one thing. Whenever we were comparing the torque generation by different muscles of the knee joint, we just saw that amongst the flexor group of muscles, hamstring is the muscle that produces the largest knee flexion torque, followed by gastrocnemius and then the other muscles. All right, and that too, hamstring also has its greatest moment arm at about 45 degrees of knee flexion. Okay, so it means that the maximum internal torque generation for the flexion of the knee joint is at 45 degrees of knee flexion. Okay, at that point, hamstring can generate maximum amount of torque there. Okay, so the muscles produce maximum torque when they are fully elongated. I gave you two reasons behind that. Okay. Now, flexing the hip to elongate hamstring promote greater knee flexion torque. That is because of the stretch reflex activation that we had talked about. Flexing the hip to elongate hamstring. Okay, I just read that. Now, with the knee flexed to 90 degrees, the internal and external rotators produce peak torques of about 30 Newton meter. So, we in very earlier session yesterday, I just told you that there are some books that tells you that the tibia can rotate in the transverse plane also. It can rotate external also. It can rotate internal also by the virtue of biceps femoris also, by the virtue of semi-membranosus also, by the virtue of semi-tendinosus also, by the virtue, by some cause of sartorius also. Okay, so it is saying that whenever the knee is 90 degrees of flexion, maximum torque is generated by the internal and external rotator of the tibia, and that is about 30 Newton meter. All right. So with hips and knees flexed to only about 20 degrees, when the hip and knees 20 degree of flexion, the peak internal torque exceeds the external torque by 40 degrees. This is the reason why I showed you the diagram also. We are able to have a static equilibrium with 20 degrees of hip flexion and about 20 degrees of knee flexion. Okay, because there is more internal torque at that time and it can exceed the external torque also. Now the external torque doesn't need to have that much amount of weight to be applied at the proximal end of the ankle. The weight of the lower leg can also prove to be this external force or the external torque. All right. Moving on to the other thing, that is the movement combination of the hip knee extensions and the hip knee flexions. Okay. Now there can be two things. Okay. This time we are talking about flexion and extension at both the joints at the same time. That is, hip is also in flexion, knee is also in flexion, and hip is also an extension, knee is also an extension. We can talk on the atypical patterns also. This is a typical pattern. We can talk about it in the atypical pattern also, when the hip is in extension but the knee is in flexion, and hip is in flexion and knee is in extension. Okay, but talking in the typical pattern of hip and knee extension. Now, which muscle is responsible for the extension of hip? That is your gluteus maximus and hamstring. Gluteus maximus and hamstring are causing extension at the hip joint. Now, classically, whenever hamstring is contracting, it must cause a flexion at the knee joint also. But whenever the hip is going into extension, then the length of the rectus femoris muscle is also challenged. Okay, so when the length of the rectus femoris muscle is challenged, it causes some amount of extension at the knee joint. But at the same time, the vastus group of muscle comes into action so as to make a force couple with the gluteus maximus and semitendinosus muscle, such that it causes it gets activated and it increases the internal torque generation for the extensor group of muscle or the extension of the knee joint. Okay, that is what is written. Let us read it out. What is written here? In hip knee extension, vastus group causes knee extension and gives optimum length to the semitendinosus muscle to contract and cause extension at the hip joint. It is always along with the action of gluteus maximus also, because alone semitendinosus muscle cannot cause or cannot generate extension at the hip joint. Okay. Now, activation of vastus muscle and gluteus maximus is simultaneous to biarticular semitendinosus and rectus femoris. Okay. So rectus femoris is also, I told you, it is a two joint muscle. Okay. So whenever there will be extension at the hip joint, this muscle will get stretched, and eventually the stretching of this muscle will cause extension at the knee joint. All right, and this eventually works in the posterior compartment also, where the semitendinosus muscle is getting activated, which is again a biarticular muscle, which is causing extension at the hip joint. But because of the action of rectus femoris and the vastus group of muscles, it is not able to generate required a sufficient amount of flexion at the knee joint. Okay, now electrically active vastus and semitendinosus favors extension at the knee joint. Okay, that we have already talked about. Now, because of the semitendinosus causes extension at the hip, which shortens its length, this decreases the force of contraction at the knee. इट इज बिकॉज ऐसा हो रहा है कि सेमीटेंडिनोसिस मसल जो कि हैमस्ट्रिंग का एक पार्ट है, अब हुआ क्या कि सेमीटेंडिनोसिस हैमस्ट्रिंग का पार्ट है तो वो दोनों जगह काम करती है, बाय आर्टिकुलर मसल है, हिप पे भी काम करती है और नी पे भी काम करती है. तो अगर वो अपना मैक्सिमम फोर्स या मैक्सिमम टॉर्क जनरेशन हिप के लिए कर रही है बीइंग एन एक्सटेंसर, तो वो अपना उतना ज्यादा फोर्स नी के ऊपर नहीं लगा पाती है टू कॉज फ्लेक्शन. और इम्पॉर्टेंट बात तो ये भी है कि वेस्टस ग्रुप और रेक्टस फेमोरिस जो है उन्होंने वैसे ही नी को एक्सटेंशन में ला करके रखा है, तो वो उस फोर्स को ओवरकम नहीं कर पाती है. दैट इज व्हाई देयर इज अ मूवमेंट कॉम्बिनेशन ऑफ हिप एक्सटेंशन along with knee extension. Now coming on to the atypical movement combination that I was talking about, it is a very easy combination that we usually see in our clinical practice also. It is about the what you can say, force couple interaction. Okay, now what does this has to say is biarticular rectus femoris muscle shortens at a greater distance. Now whenever there will be contraction or shortening of the rectus femoris muscle, it will cause flexion at the hip joint and extension at the knee joint. We all know that because it is a potential extensor of the knee joint and a potential flexor of the hip joint also. Okay, now this now with relatively higher velocity in order to flex the hip and extend the knee. It is usually done in cases whenever a sports person is kicking a football. Okay, this is very evident in this. Now, based upon the length, tension, and force velocity relationships of the muscle, the rectus femoris is not able to develop a maximum knee extension force. Now we know that earlier also we have seen that the cross-sectional area of rectus femoris is relatively less as compared to the vastus group. This is another reason why it is not able to generate sufficient amount of extensor or extension torque at the knee joint. Then because of the flexion of the hip joint, the hamstring gets overstretched both at the hip joint and the knee joint, and thereby it eventually causes flexion or the resisting motions of the extension. Okay, now biarticular rectus femoris is overstretched across the hip and knee whenever it goes into the hip goes into extension, and it causes the stretching which eventually causes which eventually has to cause extension of the knee joint. But since along with the gluteus maximus that the hamstring is also getting activated, your knee joint goes into flexion along with the extension of the hip joint. Okay, that is the force couple of the gluteus maximus and the hamstring. They cause extension at the hip joint and flexion at the knee joint. And your rectus femoris along with the vastus group is causing flexion at the hip joint and extension at the knee joint. I think that must be clear. You must have learned two force couple. That is, one is during rectus femoris plus vastus, and your gluteus maximus plus hamstring. Okay, they cause hip flexion, knee extension. They cause hip extension, knee flexion. All right, easy, I think. This is what I was talking about. The action of kicking a ball involves rapid and full contraction of the rectus femoris to simultaneously flex the hip and extend the knee. The goal is to dissipate the forces of the rectus femoris. That is what we were talking about. Okay, coming on to the last section, that is the deformities which are available at the knee joint. So the first and a very common deformity at the knee joint is the genu varum. That is the varus deformity. And the varus deformity is the reduced internal angle of the knee joint. Supposingly, this is the knee joint. Okay. Okay, this is the medial area, this is the lateral area. Okay, now this is the medial angle and this is the lateral angle. Okay, now if this angle reduces like this, it becomes genu varum. Okay, and if this angle increases by this is called genu valgus. Okay, so this is the varus and this is the valgus. Now, genu varum, popularly known as bonies, okay, with increased joint reaction force. Okay, now consider one important thing is that if it is the bony, okay, in that case you have your knee like this and like this. Okay, so there is increased compressive loading at the lateral compartment and reduced compressive loading at the medial compartment. Now always remember that it is not like that where the compartments which has more joint reaction force will always be exposed to degeneration. It is like that those areas which do not have any compressive or reduced compressive loading, all those areas that have, they are always deficient of nutrition. And those areas which are deficient of nutrition, they always eventually develops cracks in their articular cartilage. वो एरिया जहां के आर्टिकुलर कार्टिलेज को खाना नहीं मिल रहा है, या वो एरिया जहां पे कंप्रेसिव लोड बहुत कम है, तो वहां पे एरिया, उस एरिया के आर्टिकुलर कार्टिलेज को खाना नहीं मिलेगा. वहां पे synovial what you can say synovial fluid accumulation will be lesser. In that case it will create cracks in that particular articular cartilage. So this crack will eventually lead into degeneration of that particular joint. Okay, now the joint reaction forces normally aligned knee passes equally from both the condyles, although it is more on the medial condyle. While walking, total knee receives a joint reaction force equals to about 3 times of body weight. We all know that. Now this increase is due to combined effect of muscle activation and joint reaction force produces at the heel contact. Okay, we'll learn about all these things when we'll be studying gait. The malalignments of the knee are frequently associated with unicompartmental osteoarthritis. I told you the mechanism of the unicompartmental osteoarthritis. Okay, so one area will be having more compressive loading, so it will have more degeneration. It will have more degeneration, so the extent of osteoarthritis will be greater in that particular compartment, especially the lateral one. Okay, now, sorry. Okay, I'm sorry. I've just mentioned the this wrong. Okay, so the more compressive loading will be there. More. Wait. Okay, more compressive loading will be on the medial side and less compressive loading will be on the lateral side. Okay, so there will be increased compressive forces on the medial side, and medial joint compartment arthritis will be more in case of varus deformity. Okay, because the medial angle is reduced. Okay, the one I told you is about the valgus one. Okay, the lateral compartment osteoarthritis. A vicious circle is generated with varus causes increased unicompartmental loading, leading to increased reaction forces on that side. That is the medial side. Okay, medial side, leading to osteoarthritis of that compartment. Now, surgical treatment involves high tibial wedge osteotomy. Foot orthosis can also reduce stress on the knee joint. Lateral wedge insoles can decrease the varus torque on the knee joint, decreasing the load on the medial compartment. Although if it is a flexible knee deformity or it is an adaptive knee deformity, you can do something. But in cases when this knee deformity is congenital, you do not have much to do in terms of orthotics or in terms of exercises. You must go for an derotation osteotomy, which eventually, or any wedge osteotomy, which eventually could help the patient about it. Okay, talking in the similar terms about the genu valgum. Genu valgum is the increased internal angle, which eventually causes. See, now this time there is increased loading on the lateral compartment of the knee joint. So more compressive force on this side, less compressive force on this side. Okay, so this side will have more weight and get degenerated. This side will have less nutrition and will get degenerated. But the extent of degeneration will be more on the lateral aspect. Okay, so again, a unicompartmental osteoarthritis will be observed in case of genu valgum also. It's also known as knock knee. Contributing factors may include coxa vara or pronated feet, which is quite common in females these days. And valgus deformity has more prevalence in females as compared to the varus deformity also. And these deformities are also more common in female because of the prevalent foot deformity, or because of the widened pelvis, or any prevalent deformity at the hip joint also. Okay, so these factors can contribute to it. Although with most the prevalence of pronated foot in the female population, gender is eventually more as compared to the male population. Okay, with a 10 degrees excessive genu valgum than normal directs the joint stresses over the lateral compartment of the knee. That is what I told you. Okay, only a 10-degree greater deflection can cause excessive amount of stress over the lateral compartment of the knee joint. Okay, in the presence of intractable pain, loss of function, and lessened quality of life, the knee replacement surgery is eventually indicated. If the patient is of lesser age, you can go for derotation or wedge osteotomies. And on consultation with your consulting orthopedic surgeon, obviously, you can plan it for the surgery. All right. The last thing that we have to talk about today is your genu recurvatum. It is the hyperextended position of the knee joint. That is also very common these days, both in males and females, although female counterpart are more exposed to this deformity as well, because of the pertaining what you can say posture of the foot, or the malaligned or malformed posture of the foot, and widened pelvis also is one of the major reasons. All right. Now, full extension with slight rotation is the knees close back position and stable position. Physiologically, knee hyperextends to about 5 to 10 degrees, which is actually normal, directing the line of gravity anterior to the medial lateral axis. Physiologically also, the medial lateral axis of rotation lies a little anterior to that of the line of mechanical axis, or line of the gravity. Now, gravity produces slight knee extension torque, because this also lies the joint reaction force, or the ground reaction force, which is coming from the ground. The line of that force also lies a little anterior to that of the medial lateral axis of rotation of the knee joint. Okay, that is how it produces. Physiologically, it produces some amount of genu recurvatum. That is what is about 5 to 10 degrees. Okay, by placing the mechanical axis a little anterior to the medial lateral axis of rotation. Okay, now this naturally occurring extension torque is resisted by tension in the posterior capsule of the knee joint and the flexus of the knee. Here, the role of the posteriorly lined up soft tissue structures is too much. Okay, and the posterior lateral structures also, that we had a discussion in the class yesterday. So the structures which are lying posteriorly, that could be the posterior muscles also, hamstring muscles, gastrocnemius muscles, and majorly the posterior capsule. The tensile strength of the posterior capsule eventually helps us to prevent this extremes of your genu recurvatum position. Okay, hyperextension beyond 10 degrees is called genu recurvatum, which comes into, or which falls into the abnormal category. All right. Now, common causative factors may lead to the overstretching of the posterior capsule, which is pretty much common. Okay, which is pretty much common, that you can see in this case. Okay, the second B diagram is a correct diagram for this. Okay, in this, there is an integrity of the posterior capsule is maintained. In the first diagram, there is an overstretched posterior capsule, which eventually directs the line of gravity or the mechanical axis too much anterior to the medial lateral axis of rotation. So the external momentum of the body weight increases and it goes into extension. The extension or the recurvatum promotes more recurvatum. If it is already in recurvatum, then your external momentum is more, and because of that, the muscle firing is in such a pattern, or muscle activation is such a pattern, that it promotes more genu recurvatum. Okay, so once the deformity, it promotes more deformity. Okay, so always remember that. So by this, we have done with the biomechanics of knee joint, and the house is open for questions. You can ask me questions in your comment box, in the comment box. Let me check if you have any questions. Okay, you gave me answers previously. If you have any questions, you can ask. If you have any questions, you can ask. I'll be there to answer. If you have any questions, you can ask. We'll be waiting for some time. Okay, if you have any questions, please. Hello, good afternoon to everybody. The house is open for questions. If you want to ask any question, we'll be there. Any more questions? Anybody? All right. So if you have any questions, you can contact me by Telegram channel, by WhatsApp, by by this my website, by Facebook, by Instagram. Anyhow you want to get connected, you can always ask questions. And most importantly, I would like to tell you an important thing. In the last test also, when we took a quiz regarding the biomechanics of hip, and eventually a lot of people participated in that quiz and they did good. I expect the same thing this time also. I will be generating a quiz for this knee joint also, and I would request everybody to participate in that. Will not be disclosing any results of that quiz, so that is only for you people. So I request everybody to go for that quiz. Okay, we'll be uploading it in the channel, Telegram channel. The name of the Telegram channel is Jaipur Rehab Physiotherapy Updates. So please go on to that, join that channel. You'll get a lot of updates about not only about the classes that we are creating here, we are generating here. You'll be getting update regarding the whole physiotherapy fraternity, and we'll be putting very important declarations. We'll be having very important announcements, and also we'll be going for quizzes. Okay, now we have some questions on the chat box. They're saying, in osteoarthritis, what kind of exercise are recommended? The exercises which do not pose any excessive external torque demands, or which do not pose any increased compressive loading on the knee joint, those exercises are very well recommended. It means, जैसा कि हमने अभी देखा था, we just saw in our few slides that whenever we go from 90 degree in the last 45 to 90 degrees of extension in open kinematic chain, there is always increased amount of external torque, which eventually increases the torque demands, or which eventually increases the compressive loading at the knee joint. So those exercises must not be included. And whenever you get up from the half squat position till 45 degrees, from 90 degrees till 45 degrees also, it poses huge amount of stress on the knee joint. So those also are not recommended in cases with osteoarthritis. All right. So another question, why in OA knee cases lateral tibial torsion occurs with restriction and releasing with popping sound? Okay, whenever you have increased loading onto the lateral compartment, it will try to go for lateral tibial torsion. See, we should be in futures. I'll be trying to have some classes that would be related to tibial torsion. So tibial torsion is a different aspect, though it is very well related with osteoarthritis. So whenever you the patient is of higher age, or if the patient has a persistent deformity from last lot of years, the deformity eventually leads to tibial torsion. Okay, in that case, you must know there was my study also, which is still not published yet. So I was looking onto the effect of extensive usage or exercises by the medial hamstring muscle to prevent lateral tibial torsion in cases of genu varus condition. Okay, so genu varus usually try to what you can say formulate a sort of lateral tibial torsion at the tibia. Okay, now sir, kindly arrange another lecture on other shoulder joint. We'll be taking it. We are going according to the module. So right now, the first two lectures from the first two topics from the first module are being done. So the next topic that I'll be taking in the next week, Saturday, Sunday, that will be ankle joint. If time allows us, I'll be taking foot also, but I'll be trying to at least finish off ankle joint. So with ankle and foot, we'll be completing our first module. And once we complete our first module, then we'll be going on to the second module. Okay, the second module will be gait and posture first. Okay, then we'll be going to spine, and then the fourth module will be your upper limb. Okay, so I'll be taking all the joints of the body. So after spine, that will be upper limb. Okay, so stay tuned and stay connected with us. We'll be taking all the session. Thank you so much for being here, everybody. So I'll see you very soon on the Telegram channel, and I'll see you next week. Okay, we have one more question. In case of pronated foot, what happens at the knee or with the tibial torsion? Whenever, so okay, I'll take this kinematic chain. Whenever your foot goes into pronation, your tibia goes into internal rotation. Whenever your tibia goes into internal rotation, because of the weight which is falling, and because so as to maintain the relative position of the knee joint, the femur rotates externally. Whenever the femur rotates externally, because of the increased force on the lateral compartment, the tibia deforms into lateral tibial torsion. Okay, so whenever you have a chronic pronated foot, you have more chances to develop lateral tibial torsion. Okay, so this is what happens when you study the whole kinematic chain. All right, so I hope I'm clear to everybody. Dr. Roxana, if it's okay, can we stop the broadcast? Or any more questions you are coming up with? Anything, anybody? All right. In that case, I'll just be signing off from here. So I'll see you next week here only with ankle joint biomechanics. Thank you so much.